before he first asked us to be on this panel, I thought, oh yes, this is easy peasy. This is, as a department, we sit on multiple collaborations, we lead collaborations, and this is what we do as public health, right? And then I started on the presentation, and I scrapped it, and I started again, and I scrapped it, and I started again. I did that 5 times. And I thought, what do I really want to say? In a room full of experts and professionals doing this work all the time, how do I narrow the focus to make a presentation meaningful to you? And how do I interweave the complexity of the work of engaging partners? This is something that I would do as well. And our public health director who may have met when this conference kicked off said, well, just tell our story. Tell the story of what you've gone through, and tell the story of our agency and how we try to create partnerships for our community. And then yesterday, we were getting to speak about telling stories. And really, what resonated the most for me from his talk was, how do we create meaning from what people are saying, and how do we allow ourselves, and how do we allow our audience to create meaning from our presentations? So my storytelling skills are not as strong as Daniel's, and you'll see that in my presentation. But I hope you just kind of bear with me and listen to the story I have to tell, and hopefully it'll help clarify some of the stories that you're trying to work through in your own communities around creating partnerships. Because as you know, working with people is complex and difficult, and really that's the basis of building partnerships, and it's really about how we relate to other people. So Lori asked me to talk a little bit about Eagle County, where you're sitting right now, and I'm just going to paint a very broad overview of our community. Eagle County is about 52,000 people. We're in the kind of call it the I-70 corridor from Vail to Cero. And as you know, you went over Vail Pass to get here, and then as you start to head out past Cero, you hit the little canyons, and we have these geographic kind of barriers that create some isolation for us at times, especially in the winter. There's the resort community that you're sitting in right now, and then as you head west, you start to get to ranching communities. This area is abundant in natural resources, and it's a playground, and it's really what draws a lot of people to live and live here is this natural beauty and the ability to get out and enjoy this fabulous place. But what drives people to move here and live here also drives up the cost of living. And you may have noticed some of that just being here in Vail. The cost of living here is 66% higher than the national average. The workforce that you've been interacting with at this hotel for the last few days, they're making about $15 an hour. The median home price is over $500,000. And so you can imagine the wealth disparity that we start to see in our community. Our healthcare costs are the highest in the nation for our county. And 30% of our population checks the box that says Hispanic or Latino. Over the next 10 years, our age 65 plus population will grow by 169%. And those are the facts, and that's the data, and that's what we serve out when we write grant applications to share our community, what our community is all about. But what you might not know about this community is that we have over 139 registered nonprofits that care really deeply about our residents' health. The business community gives to every single golf tournament and every single silent auction that comes down the pipe. And if you looked at Vail daily, you might know that it's happening on a weekly basis. We are a really hard-working community, and there are people that are working 2 or 3 jobs just to be able to make the families' lives better. And finally, to quote from your community partner, we are relentlessly collaborative as a community. As mentioned before, Eagle County has the largest percent increase of older adults in the state. I love this picture because I feel like it really shows our own perceptions of ourselves. We're all aging here right now. If you turn to the person sitting next to you, that is the one thing that you share in common with that person. And I think most of us are in this disbelief, right? I know I am. And even you're on an individual or a community level, it's hard to get out in front of the HOAs that we're going to see both in this community and across the state and across the nation. And we know that as we age, our dependency on external factors grow, whether that's a need for technology or additional assistance from family or friends or from your community. We know that to age well, both at the individual community level, you have to plan. So you have to plan for yourself on a personal level for your financial health and your personal health. And then as a community, we really need to be focused on how we plan for our older adults to have an age-friendly community. We know that this is our responsibility as a community. That's why we have taken on this initiative. Luckily, I have the good fortune of working with a team of individuals who are passionate about older adults and work for one of the only public health departments that has prioritized healthy aging and actually houses all of our senior centers in Eagle County. And I just want to acknowledge my team right here sitting at this table. They've been involved in this planning effort that I'm going to be talking about and have been the folks that have driven this process. And they're not standing up here with me, but they might as well be because they're the soul behind the work. So with that, we knew that we had an opportunity as public health to really take on the initiative of addressing what it looks like to age in place in Eagle County and what it looks like to become an age-friendly community. My team has over 20 years of relationships built in this community through working directly by providing meals for seniors, through running falls prevention programs, through running caregiver support, and just being a community connector. And through the work that they've done, the trust between my team, the older adults in our community organizations, runs extremely deep. And that was instrumental in getting this work off the ground. We already had the trust, and we already had the relationships built. So as public health, we knew that we could leap into this work very quickly. But we also knew that we were going to need unique and meaningful partnerships to make it work. So we decided, like all other public health teams do, to assess and plan with help from our partners. And we had a lot going for us already. And we had the support buy-in from our county leadership. We had an organized and driven project management team. We had meaningful relationships and trust with older adults and community organizations, and a shared understanding of what it meant to age in place in our community. So we assessed. We did quantitative gaps analysis, we did an asset mapping, we did focus groups with Spanish-speaking older adults. We worked on community interviews with community partners and also older adults, community organizations. And then after we did the assessment, we invited many of those people to join us in creating the plan. We brought older adults and caregivers most impacted by the challenges. We brought in housing. We brought in Eco-Transit, which is our local transportation company. We brought in our folks that were really helping with reducing social isolation, so our libraries and our community college. We brought in our senior centers. We brought in home care, folks that were focused on access to healthy food and caregiver support. So when you look at these logos, it's sort of who, with the business community, we have some very non-traditional partners at the table. And we worked really hard over the last 6 months to gather community voice to create a plan with a vision of older adults being able to age in place with the highest quality of life. We created community-driven goals and objectives focused on the social determinants of health. And from a variety of perspectives, the assessment and planning process has been a success, and we're well on our way to implementation. And so I feel like I could end my presentation right there, but I'm not going to. So I feel like sometimes we come to these conferences and we hear all the success, and we know that the work is messy, and we know that it can be difficult. And so I want to share with you my own difficulty in the work that we did. And I do want to illustrate the work that we've created so far has been a success, but there are pieces that I've struggled with through the process, and that's the barrier that I felt and had to get worked through. So I'm going to share a little bit of that with you. So when we first started on this initiative, I really wanted a unique and meaningful collaboration, and I envisioned it to be kind of on this empowerment spectrum. So when you look at this at the very bottom of inform all the way to empower, and I had this vision of rallying our seniors in our community, and they would be out marching in the streets and really being advocates for themselves and creating an advocacy and empowerment, very meaningful community engagement process. And that was my initial vision. I also knew that in the past, as government, we sort of tended to be on the informed side. So we would bring people in and we'd listen to what they had to say, and then they would leave and we would never connect with them again. So they informed our process, and then that was the end of it. And they felt, I think, sometimes that they had been used to get information from it and then something along the way. So I had this vision of this empowerment piece, and I knew what sometimes we had done in the past. And where we sort of landed was in the middle. And that was my struggle, was how do I move personally from wanting to be over here in empowerment, but really landing in that middle ground. And what I realized was that it's all a process. And community engagement and community partnership is a process. And you work your best toward the best practice of what that looks like, but it's messy and it's complicated and you don't always get there. And so you have to kind of be okay with where it lands. And I'm really okay with where it landed. We really landed in this evolve, collaborate stage. And really what that looks like for us is that we did bring partners along through the whole process of assessment and planning. That's where we're at right now. We haven't implemented yet. And we really wanted to hear from them, and we involved them in a number of different levels. And we've said to them, we've heard your advice, and we've brought you through the process, and we're going to do as much as we can possible to implement what you said that you value. Do we empower our community? Are they leading the charge? No. We're still the backbone, and we're still driving the process. But we really try to listen as much as we can to what they have to say. And so, we get that collaborations and partnerships, and I think about the ideal that we want to move to. I think it got to the point where I was okay with it involving and collaborating, because I knew that if we were still in the empowering stage, we might still be at a table talking with people, and we might not have ever moved to action. And when we're talking about aging in our community, we're talking about the age rate, the time to act was 3 years ago. The time, we're already behind the 8 ball, and so if we would have waited to act, I think we would still be in a process of not getting it anywhere. And some of our folks that are involved in our process, they don't have time to wait. They need these services to exist now. In 5 years, they might not be here anymore. And so when we think about the population that we're working with and what we're trying to achieve, we really needed to get to action quickly. And so to sort of curtail and push back and have a government/community group process really important to get to action. So when we look at keys to partnership success, these are just my summary of what I think needs to happen. And that is that there has to be authenticity in relationships built. Otherwise, people do walk away feeling like you just asked for a need and then you never connect with them again. That it takes a tremendous amount of time and resources. My team spends a ton of time on this work. But the benefits outweigh the cost. Only if done with extreme integrity and authenticity. That we really tend to focus on process or problems in the beginning, but we know we need to get to action so the community feels like there's momentum and movement forward. And that we have to be carefully planned and thoughtful in the process. And that we have to share power. And I think as government, sometimes that's really difficult to do. We're not a community-based organization. We're not an advocacy organization. And so how as government do we start to share power
Karen. I love how you started out saying that you relentlessly collaborate as a community. All right, Ashley, from the city and from schools.
So, my story is one of educators. And so I have the honor and the privilege of serving the school district. And oftentimes when we think about school districts, we just automatically think about our teachers. But when we look at serving the school district's population, we have a really diverse population. So things that you might not think about are bus drivers or operations. We have carpenters, we have painters. We have custodians, we have office managers, and we have administrators. So it's not just our teachers. So we, several years ago, took a look at how can we create a model that will create a community collaboration and serve our diverse population in more commons. So we launched something called the Integrated Health Management System. So I'm going to walk you through that today. A little bit about PHiR School District. We're the 9th largest school district in the state. We have about 5,000 total staff members, part-time and full-time. About 3,200 of those, actually it's more like 3,400 now, are eligible for benefits. And as I start telling this story, we're unique in that we're self-insured. So we have our own insurance for our employees. And right now, our employees don't pay any premiums. And so that's a rare story right now in our state. We're located in Fort Collins, Colorado, but we also serve a lot of the surrounding communities. So Wellington, LaPorte, Wellington, parts of Windsor, and some of the mountain areas as well, so that's others. And we serve over 28,000 students, that's closer to 29,000 now, through 49 schools. So it's a little bit of numbers. So a little bit about the Integrated Health Management System. So it has 4 main components. There's several more listed here. I'm going to walk you through kind of each component, what all it entails, and then I'll break down community partnerships and how we're working together with those who represent each component. So the first component is an employee walk-in clinic. The second one is our lifestyle health program. The third one is wellness. And then we also have our employee assistance services. So taking a look at our mental and behavioral health program. And then we fund all of our data collection for third-party administrators. So one of the benefits of being self-insured is that we own our own data. So we can do actual targeted programming for our population because we own our own data. So our objectives in launching the Integrated Health Management System was, first of all, of course, to contain healthcare costs. So because we're self-insured, we have a large stake in our benefits plan of trying to decrease our costs because we're invested in it. And then also increasing productivity. So taking a look at reduced absenteeism, reduced presenteeism. We know that if we can keep our teachers in the classroom, then we're going to have a greater effect on academic achievement and student outcomes. And then also looking at workforce productivity. So what does it mean to have a productive workforce in the school district? And then, of course, improving employee health and quality of life. So barriers, access to care. And a lot of our employees are hourly and they don't make a lot of money. So how can we get them access to care so that they can come to work every day and again, be productive? So the first thing we launched was an employee walk-in clinic. As far as I know, we're one of the first school districts in the state to launch an employee clinic. We did it in partnership with the University of Colorado Health. It's managed by Associates in Family Medicine. So these are the 2 largest medical groups in Blair County. It's staffed with a nurse practitioner and physician assistants. And then there's oversight from the medical director. The great thing about our employee wellness clinic is that it's free. So people can walk in. They guarantee 30 minutes or less and then out of the door. So most people don't have to be there for 60 minutes, which is great. And then they also cover most 30-day prescriptions. So a great example, last year I had a really bad sinus infection. I got off work at 3:30, I was in the clinic, I was out by 4, and I had a free prescription for an antibiotic. And I was at work the next day. It also replaces most of our urgent care and ER visits. So we were seeing a really high function of emergency room visits. So this was one of the ways that we could help contain that cost. And then it also has extended also open to benefited family members. So I'm going to put that on the slide. But so anyone that's on the PST health insurance plan can access the clinic. So, and they just have to be 18 months or older. So people can even take their children if they're on the benefits. The next component is our PST wellness program. So I did that on I drove coordinating this. I always say this is like the fun part. So we really tried hard to put wellness at the forefront of our health plan. So we partnered with Lifestyle Health Fitness. If any of you are familiar with Paramount, they own 4 different fitness facilities in Fort Collins. So we work with them and we offer 50 plus free classes per month at 2 different locations, kind of a north location and a central location. These are free of cost to any PHiR school district employee, regardless of benefit status. So you could be a part-time substitute teacher and you can access these wellness and fitness classes. So that's huge. In addition, we offer free fitness assessments with a personal trainer. So they can come in, meet with a personal trainer, get one-on-one information about where they're headed with their fitness. And then we launched the WellWorks portal. So we have a points to wellness incentive program. It's kind of your traditional wellness incentive-based program, where as you participate in activities, you accumulate points. Because we're able and willing and we're self-insured, we fund that through cash payouts and paychecks. So people get a cash payout in July. It's a drawn-based, so participation is not guaranteed. But it's something that we're really proud to say that we do have the ability to do a cash payout rather than like gift cards or Fitbit drawings or things like that. And then we do district-wide challenges through that portal. So we do 2 challenges per year that are district-wide for our employees that they get points for participating in. And then we have up-to-date health information on the portal, and they also get Fitbit discounts. My favorite part about the WellWorks portal, as you're going to hear as a theme on the wellness program, is it's free of cost for all our employees and anyone can access it. So a part-time substitute teacher can participate in the incentive program. Then we also coordinate on-site biometric screenings and flu shots. So next week I'm getting ready to launch 19 flu shot on-site clinics. And we also bring our biometric screenings on-site too. So people can come to school that day, they can get their blood drawn, they can get their biometric screening, or they can get their flu shot. It's not an inconvenience to them. Plus they get points for participating. And then we work with our professional development department. So we have a great professional development department that gives continuing education credit for our employees. So we've partnered with them and we offer on-site wellness classes that our teachers get name change credit for. So that's huge. So we also have an incentivization there too. Because as they accumulate more lane change credit, they move up the pay scale. And then it integrates with our student wellness program. So we have a school wellness team at every school location. We're the first school district to achieve that. And it wasn't a small undertaking. So every school health team does a school health improvement plan. They focus on the whole school, whole community, whole child model from the CDC. And those are turned into our wellness office. So that's the wellness component. Then we have our lifestyle health management component. It replaced our former disease management program. We have a UC Health registered nurse who is dedicated to PHiR School District. And PHiR School District employees are referred into the letter counselors actually work for PHiR School District. They offer confidential psychotherapy services to all employees. You do not have to be on the benefits plan to access our EAS services. And not only can our employees go to EAS, so can their families. And they're able to receive 5 sessions per problem or per issue per year. And I always like to make a joke here, because if you've ever worked for a school district, you usually have a lot of issues. So there's a lot of tension in the classroom. So it's great so that you're not really limited or honed in on if you can only come once or twice. They're really flexible with working with you and what you're tackling at home or at work. So you can really tap into their resources. And then they also manage the PST behavioral health benefit plan. So if you go to EAS and realize, wow, you're really tackling something that's a huge undertaking, they can refer out into the community for other mental and behavioral health support. The greatest thing about the integrated health management system is the patient care and coordination pathways. So each component talks to each other and refers to one another. So a great example would be, let's say someone comes into EAS and they're struggling with bipolar depression. EAS figures out that they have diabetes, which is common among people who suffer from depression. EAS can refer to lifestyle health, and they can get involved with the lifestyle health program to get involved with the chronic disease management class to deal with their diabetes. Lifestyle health will say, hey, did you know that you can also to fitness classes to the wellness model and get points for participating in the lifestyle health program. So they enroll in wellness. And then at some point in time, we get a cold or flu, and then, oh yeah, by the way, you can go to the health clinic. And vice versa. The stories all continue. The common one we're seeing right now is that the walk-in clinic is starting to catch our employees who don't have a primary care physician. So they're referring our employees into the PCP model in the community as well. And I'm going to talk a little bit about that later too. The biggest undertaking of this whole project is data, and I am not the biggest data guru, and I've had enough data today to fill like my entire year. But what we are looking at, and I'll talk a little bit about our different partnerships, is how can we pull all of this data together to make sure that we're targeting areas that need programming, and then also to offer services to our employees that will benefit them. So we're also doing a cost savings analysis and looking at our ROI, so I'm going to talk a little bit more about that as well. So collaboration and partnership. So I'm going to break it down to each partner and how we kind of work together with them. So University of Colorado Health is a pretty big health system. Our main contract is with the University of Colorado Health. They contract with Miramont Lifestyle Health Fitness to manage the urgent care. The urgent care is actually on the Miramont site. So right next door to our employee health clinic is the Miramont Fitness central location. So they own that building. And then they also provide medical directorship of the urgent care, which are co-sharing with associates with family medicine. So I'm going to talk a little bit about that. The greatest thing, I'm sure they would agree with this completely because it was such a workload, but we moved everybody onto Epic. So associates in family medicine and the University of Colorado Health are now all on Epic. But it's great for us as an employer because if someone comes to our employee health clinic to receive services, their information is put into Epic so that next time they go to their PCP in the community, the PCP knows that they've accessed the employee health clinic. And we were really starting to see this be successful is with the lifestyle health program. So now in Epic, we're able to let our PCP community know that these employees are eligible for lifestyle health services and they can refer into the model. So the greatest thing about our model is we're trying to work with our PCPs. We're not trying to take a side of the program. All right, so associates of family medicine subcontracts. The staff that's actually in the clinic works for associates of family medicine. And then Miramont, like I said, they provide the lifestyle health services, the health coaching, nutritional counseling, the classes, the personal trainers. And then UC Health Plan Administrators is our TPA. And so they help with all of the data collection. We're developing a boilerplate report. So we have a lot of work doing on all of the data. So I know one of the things that we wanted to talk about today was community collaboration and some of the hurdles that come along the way. So hurdles along the way, Board of Education and district leadership support for a big one. So we had to go to the Board of Education, we had to present what we wanted to do, and we had to get approval for it. And then we had communication to a large, diverse population. So we have 60 plus locations and so many employees. How are we going to let them know everything that we're trying to do? And then education to the PCP community, letting them know we're trying to work with you. We're not trying to work against you, and we're not trying to take your patients away from you. And then also just ensuring referrals across the ecosystem, so making sure that all components are referring to one another. And then, of course, making sure that we're HIPAA compliant, so making sure that each components are following the lines of HIPAA. So some recommendations and lessons, build trust. So it took a lot of trust for us to build from our employees, but a lot of trust for us to build with our community partners in order to launch this model. And then communicate. So whether that's internally or externally, we have a lot of meetings where we're just making sure all the I's are dotted and all the T's are crossed. And then have project leaders from each organization. So when you're looking for such a large-scale program, we had to really identify who from each organization was going to be a project leader and what were they responsible for, so that we weren't duplicating services and everything was kind of flowing gracefully. Establish baseline data early on in the project, and then making sure that you collect feedback. health and wellness and productivity are linked together, that we're ultimately going to see it in student achievement in the classroom. So we're hoping and we're knowing that a school that fosters a culture of health and wellness, it'll maximize the potential for success all across the board. So, thank you.
This says to you the importance of really listening to each other, to hear each other's stories. When you think about a wellness manager in a school district, did you think about all of that? That's incredible. All right, Shelley, would you come on up and tell us about what's going on in Logan County?
Good afternoon. Thank you for having me here today. My name is Shelley Morris, and I'm the Executive Director of the nonprofit in Logan County Community Cooperative Ministry. This is my lovely assistant here, nothing better. Travels me a lot of places. We don't have a big fancy PowerPoint presentation for you, as there's no funding or resources for it in my neck of the woods. It's just not how we operate. We operate in very simple layman conversation type terms, so that's how I'm going to present to all of you today. It's been very overwhelming to come here and present in a group full of epidemiologists, toxologists, medical practitioners. It's just extremely, I don't know, fulfilling, I guess. I have been to some of these presentations and I have been educated, so I just want to say thank you to all of you people for doing your hard work and educating somebody like me who seems so simple. I hope I do the same for you guys. We have been a nonprofit serving our community since 1981, and our architecture is really simple and faith-based. We started out with 6 local churches, and their pastors seen that there was a need in the community, and what do they do about it? And so we have extended that into our community as 26 churches now involved, along with many businesses, local individuals, and grants and foundations. We do have a vision, and our vision is to just simply provide coordinated emergency resources and assistance to people in need. It's just that they have a need, we want to help them. We offer temporary shelter assistance, rent arrears, initial rent, utility assistance to prevent homelessness. We are the only food pantry available in Logan County, and we offer 3 food programs. We also offer the community a home health care equipment program where for $25 deposit they can come in and check out bath benches, floor risers, wheelchairs, crutches, anything that they need, to serve their needs for their time. And upon return, you receive your deposit back. So essentially, that makes that free to the community. And we also take donations from the community of used clothing, household goods, and furniture, and we operate a thrift store to struggling and low-income families so that they can benefit from the savings and afford to meet the children. A bit of statistics: Logan County's population is approximately 22,450 people, and we serve through our programs nearly half of that population. That doesn't mean that it's half of the population coming to us, but it's over serving these people maybe repetitive times through the year that we serve nearly 11,000 people through our organization. And we are only a staff of 5. Our biggest community food drive is almost upon us, and that is our Christmas basket program. We solicit the community and churches and businesses to help us gather food to be placed in the baskets. And then on the second Saturday of December, we gather a large group of volunteers and the community, along with fire department and local businesses, to help deliver the food baskets to those in need within our community. Last year, we delivered 415 baskets in a matter of 2 hours on December 13th. And that program is really what brought me here. It started with a call from our local health department asking what they could do to help with the Christmas basket program. Lynn, the coordinator for a small group of young people ages 7th grade through high school who are taking a stand against tobacco. Stand meaning stop tobacco and nicotine dependence. And they call themselves the Northeast Youth Taking a Stand. And this was a young group of people looking to assist us. They were small and they were passionate. I told them that loading vehicles with that area also. So when I met with this group of young people at this meeting, I was moved by them. They were so passionate, you know, to see their families and their friends and their smoking habits was just something that was just very much on the top of their priority list. And when you see young people who want to make a difference in their high school, in their community, or just simply in their family, I'm moved by that. I want to take initiative. It's very rare that you get young people involved anymore. We don't educate our people to do this. We want them to be involved, but we don't have a family quota that says be involved. Our families aren't involved. We're all pressed for time and going in 100 different ways, and so it's really unique to see a young group say, I'll take the time out of my day and do this. So I made several suggestions to them through their meeting, and that began our relationship. Several days later, the coordinator called and said that the high school girls had this wonderful idea to help campaign their program and helping with ours. And the suggestion was, could they apply an agreed-upon logo representing the stand group to the boxes or cans that would be delivered in the Christmas basket program. The logo idea came about and was created to fit the top of a can of tuna or a can of fruits or vegetables that would be going in these Christmas baskets. However, that really bothered me that all this effort was going into the design of these logos that stick on top of these. And it seemed like with a can of tuna or a can of fruit or vegetables, that the logo would only be viewed for just a matter of seconds, one-time look, and then it would be thrown away. So I had to give it some thought. Think, okay, what kind of item in these Christmas baskets could we put this sticker on and give more meaning to what their efforts were for? And we decided that the peanut butter lids would be the best option. The product would be opened multiple times by the family, and the logo would be viewed by the captured audience over and over again. So on top of these, it gives their insignia with a fist, and it says stand in the center, stop tobacco and nicotine dependence. And then it says around the edge of this, it says free resources to help you quit tobacco. Colorado Quit Line gives a number, and the Northeast Colorado Health Department gives their number. So that was distributed to 415 families on that morning to get the Christmas food basket. Christmas basket season came and went, but our relationship with the youth group was maintained. One evening during the stand meeting, we were discussing how we would see tobacco affecting people's lives daily and what kind of effects that had. And I explained to the young students how frustrating it is to see people use our food pantry to help stabilize their family's needs. And when you assist that family with the groceries by taking the groceries out to their car, and you see the new cartons of cigarettes and beer in the trunk, you know that priorities are kind of confused. Basically, they got the idea, these young people. They said, when you see alcohol and tobacco products in the trunk of a car, you see that feeding their family is not the high priority over their own personal addictions or their own personal pleasures. We discussed the financial savings that a family would gain and the overall health benefit to all the members of the family, not to mention the long-term health costs if the use of tobacco products were to simply diminished. In our discussions, we also talked about how being a victim of tobacco use has affected our own personal lives. I discussed how our newest addition to my family at that time was a rather baby Sphinx kitten, those little alien-looking, hairless things. How he was bred and raised in a home that smoked heavily and is now a forever chronic asthmatic. A long-term health condition and monthly above and beyond expense that I did not think I would be taking when I paid the $500 for this wonderful little, but he is wonderful. We take him as he is. So. But it was disappointing to know that it does affect not just people, it also affects our pets. I also explained the sad and painful loss of my buddy and my grandfather in 1988, right after my high school graduation. And then the loss of my husband and the father to my children in 2000 due to tobacco dependency, and now my own father is suffering a horrible, long, drawn-out death from tobacco dependency, all due to this. Nicotine is just bad. like these young people and these young students have become passionate about finding ways of leading people to tobacco cessation. Within a short period of time of our collaborative efforts, we implemented the Colorado Quit line into our food pantry program. That was in February 27th of this year. By placing a questionnaire on the back of the food application, and based on the answers given, we would refer them to the Colorado Quit line to seek advice and tools in their hopes of quitting. We had great success, and we referred many of our clients to the Colorado Quit line. Our questionnaire, this is funny, you guys, because after going to all of these meetings, I just think, what you guys are mega data gurus. I got to go with something. So I told my assistant at 12:30 today, I said, you have to give me some data. I have these people, and they're like, so I have we did this today. Miles away, my assistant did this. So our questionnaire has 6 simple questions. It says, do you or anyone in the household smoke? Second question was, how much do you smoke? 5, 10, 15, 20 cigarettes, which is a pack a day. Third question was, do you smoke in the home or in your car? Fourth question, are you or your significant other pregnant and smoking? The fifth question was, would you like to quit smoking? And our sixth question, if the resources were available at little or no cost to you, would you quit? If they answered yes to that question, they were mine. So that is where I would refer to the Colorado Quit line. So the data that we gathered today were that there were 751 questionnaires filled out. These were both by smokers and non-smokers. How many were smokers? Were 413 of those were smokers. That's 55% filled them out as smoking. So that's big. How many referrals? These are how many people answered yes that they wanted to be referred. Was 33 out of the 751. That's only 8%. Really hard to get committed people in this program. So anyways, we began to see that there was a gap and a need, and the same people coming in and no results in an attempt to quit, and nothing available locally to assist them in this struggle. There were no tangible resources within our community. There were several addiction programs for alcohol or drugs, but nothing to aid a person to quit the #1 leading addiction, nicotine dependency. And this was our concern: how do we find a resource and how do we implement it in this community? Lynn, the program coordinator, became very busy finding a program resource that we could implement, and I continue to support the youth group, offering suggestions on how to enhance their program through their high schools and their junior highs, and to show agency support. The collaborative effort of somebody face-to-face, just working with the youth group and health department, saying, keep going, keep going. And I just continue to be a mentor to them. As a STAMP program activity, they had continued to make plans where more logos are made. A newer logo was designed, and this coming Monday, to put on more products within our food pantry and more peanut butter bits. And there was an increase in their attendance within their program and participation and an interest to do more within our Christmas basket delivery program for this year. After several weeks of searching and coordinating, the decision was made that the best fit for a resource would be the American Lung Association Freedom from Smoking program. It has a long history of success, and it doesn't display itself as the miracle fix. If you do this, this happens. It is a program designed to give a person tools, resources, education, relapse prevention, recovery symptoms, coping strategies, a quit plan, group support and participation, weight management, lifestyle changes, and how to stay smoke-free. I like that idea. It was a tool that would be offered, something that seems so simple to me, and not this miracle fix, but something that people could do if they just kept working at it. Lynn asked if I would attend the program facilitator training because I had some funds left over from the previous grant, and that would send me, and that way I could keep my agency involved and keep the program in our community. And I felt that it would be a great outreach program for cooperative ministries to become involved in. So I did, and so now I am the training facilitator for the Freedom from Smoking program. The very involved. So lack of participation in the community was a huge barrier for us. And just simply the commitment to quit. I mean, everybody says, I want to quit, but nobody really wants to quit. Put the effort into it. Many of our clients that our agencies serve cannot afford the fee to participate in our program. I think the stigma came when I presented this program through my agency who serves low income and socioeconomic struggling families, presented to the community that this was a program designed for my clients. But it's not. It's a program designed for anybody in our community. So the stigma and the status that goes through public service communities, I think is a huge barrier for us, and we're not really sure how to break this because there are very, very few resources, very, very few nonprofits, and one Northeast Colorado Health Department. So finding a place and a way to break this barrier to make people understand that just because you go buy birth control through the health department, or that you don't use my services but you donate to my place, doesn't exclude you from the opportunity to quit smoking. Our agency's location may not be the most fitting, and educating the community that this program is for everyone. Funding, of course, is always a barrier. Telling me how to close, I will really quickly. The benefit of this non-traditional partnership is that a resource that has never been made available to the community is now available and accessible. It is truly started because a small group of kids decided that they had a passion and a purpose for it. They never saw their ideas expanding into this. It was a small step approach. The greatest benefit is that I have been blessed to have met a great group of kids that have a victims of tobacco dependency, just wanting to make a difference in someone they love. So this is what I recommend, and this is what I tell them. It is in the small steps that big things happen. We just have to keep going.
And we thought that with 3 people, we wouldn't be able to fill it. You can tell how passionate these folks are and how passionate they are about collaborations and the partnerships in our communities. We had examples from local public health, from schools, and also a faith-based organizational example. And think about all of the partners that they reached out to. I didn't hear the word egos. I didn't hear the phrase unbalance of power. I didn't hear that people weren't working together and there was tension. I think, like you, I heard passion, trust, unique and meaningful partnerships, respect, common goals. Shelley at the end said, if you have a need, we want to help. I think we all come from that place. We didn't have time to hear from you and have you ask questions of the panelists. What I hope that you will do is to find them tonight and ask them your questions. What I also hope that you will do is to reach out to one other person tonight or tomorrow to learn about collaboration in their community. Or just find people you know tonight. Find somebody else and learn from them. Because we're all passionate about these partnerships and we all care so much. So learn what other folks are doing. Please join me once again in thanking our panelists for their leadership and their collaboration.